Church in North Minneapolis and proud to be a partner in the Black Church Power Project. As a pastor, every month I find myself at this wonderful hospital visiting families in moments of great trauma and uncertainty. I'm able to pray with people and support them as they're in the trenches figuring out how to make difficult decisions. And they've received amazing and wonderful care. We've been here with people through the highs and the lows of life. And even myself, in October of last year, after a pedestrian hit and run, I was rushed to this hospital, woke up in this emergency room, and received exceptional care from the amazing team here at North Memorial. But as a pastor, I also know the reality of when members come home from this hospital, the experience and the trauma when they receive that bill and those expenses, and they have to make some difficult decisions, cutting back in other areas of their life. We know the impact that healthcare costs have on our community. And that's why I am deeply concerned about the proposed merger between North Memorial Health and Sanford Health that could potentially drive up costs for healthcare while also driving down the quality of care we've come to appreciate at this amazing institution. We're especially concerned about what this merger means for the Robbinsdale Hospital, which is one of only 5 level 1 trauma centers in the state, and it's a critically important asset for our community and for the surrounding suburbs in this area. That's why today we stand to call on the CEOs, the executives. I'm just a pastor, but we know there are people who are powerful in high places. We're calling on you all to negotiate a community benefits agreement that takes in mind the needs and concerns, the hearts of our neighbors, those we serve across all sorts of boundaries. But we know and believe that the hospital is called to be an institution that meets everyone's needs. Let's do what we can to keep costs affordable, to continue to keep care at the level of excellence that we've come to appreciate. And let's make sure that all of God's children feel loved and cared for when it matters most. Thank you.
Hello, my name is Vicki McMillan, and I'm a member of the Fellowship Missionary Baptist Church, and I also am a partner with the Black Church Power Project. I am also a resident of North Minneapolis, right up the street. And I will tell you that North Memorial has been a blessing to my family over many, many years. My second granddaughter was born here after we needed to rush my daughter here because her birthing process progressed quickly, more so than normal, and we had to get her here quickly. And I will tell you that she was received and she was cared for, and my granddaughter was born here safely, and they're all well now. Even more recently, I'll tell you that I had a very dear friend who was having issues with her heart, symptoms of a heart attack. She was at Maple Grove North Memorial. They rushed her here by ambulance because this hospital had superior cardiovascular programming. And so she came here, she was assessed, diagnosed, and she was rushed into surgery where they opened up 3 arteries, one of which was over 90% blocked. It was a potentially dangerous situation. So I'm grateful to this hospital and the fact that it's in my community. I am concerned about this merger because I'm concerned that it's going to decrease the level of service that we get here and also increase costs for people that are already challenged financially. I ask that the CEOs of North and Sanford would work with our community, work with our faith leaders, work with our labor leaders to develop a community agreement plan that really speaks to these issues, to maintain these superior services and to keep the costs controllable so that people can access the services and so that they're able to afford the services, which, as I said, is already a challenge. I understand that this is one of 5 level 1 trauma centers in the state. So critically important that this facility stays as it is and we build upon what's been started and make it accessible and affordable. Thank you.
Yes. Good morning. My name is Nancy Eder. I live in a 55 and older cooperative in Robbinsdale. For me and my neighbors, North Memorial Hospital is more than a nearby hospital. It's our closest emergency room and an essential part of our community. Its cardiac unit and level 1 trauma center give us peace of mind, knowing that critical care is close by when we need it. I recently experienced that care firsthand after injuring my wrist. I was seen quickly, received the x-rays I needed, and was treated with thoughtfulness and care. I worry about what Sanford Health's acquisition of North Memorial could mean for me and my neighbors. If Sanford closes North Memorial Robbinsdale or shifts essential services to its Maple Grove campus, many of us could face a 30-minute drive or more to another emergency room. For an older person experiencing a medical emergency, that extra time can make all the difference. As I age, I may not always be able to drive myself to the hospital. I need emergency and specialty care close to home. Like many seniors, I also live on a fixed income. I worry that a corporate acquisition could not only put local services at risk, but also lead to higher health care costs that I can't afford.
That's right. That's the reality.
We are calling on the CEOs of North Memorial Health and Sanford Health to sign a community benefits agreement with community, faith, and labor leaders to keep care affordable.
Do it now, don't delay.
Protect essential services. And preserve workers' jobs. We need to make sure North Memorial Robbinsdale remains here and continues to provide the care we depend on.
All right.
Good morning. My name is Mary Turner, and I'm a North Memorial Robbinsdale ICU nurse. I'm also a member and the former president of Minnesota Nurses Association. I also serve as a regent at the University of Minnesota and a co-president of National Nurses United. As North Memorial and Sanford acquisition moves forward, our patients and our community deserve certainty about the future of their care. Today, I stand here with labor, faith, and community advocates asking Sanford to look beyond the next 2 years. We are calling on the CEO of North Memorial and Sanford Health to negotiate a community benefits agreement that ensures that costs are kept affordable, services are not cut, and workers' jobs are preserved. So in July, M&A leaders, nurse leaders, secured legally binding assurance to protect union contracts, their pension, and other employment protections through a letter of understanding. The LOU remains in effect until May of 2028 when we go back to contract negotiations. While we appreciate that commitment, nurses are asking a simple question. What happens in 2 years? 2 years makes sense on a balance sheet, but it is a very short window for nurses and frontline workers who have built their careers here and the community that depends on this hospital. Northwood Memorial is not a hospital that can simply disappear from the map. We are an essential part of the Minnesota trauma system. Every day we care for people experiencing serious emergencies. We've already heard about some of them. When someone is critically injured in a car crash, suffering a gunshot wound, or experiencing another life-threatening situation, they do not have the luxury to shop around for a hospital. They need a trauma team ready to care for them right now. And where that hospital is located matters. North Memorial is a critical piece of the trauma infrastructure serving the Twin Cities, Metro, and the region. And when I talk region, I mean a 6-state area. Our patients and community need assurance that this acquisition will not eventually mean moving services away from Maple Grove or North Memorial and Robbinsdale to Maple Grove. Growth in one community should not have to come at the expense of healthcare access in another. We can have it both places. North Memorial and Sanford CEO must tell our community what the long-term investment is for North Memorial Robbinsdale. Tell our patients that trauma and emergency services will remain available in the community close to them. Tell the people of Robbinsdale that this hospital will continue to be an anchor in the community and put meaningful commitments behind your words for them. Thank you.
Good morning. My name is Imam Makram El Amin of Masjid An-Nur, as well as the CEO of El Maoun here in North Minneapolis. And like many of my colleagues of faith, labor, and community supporters here, I'm also concerned about the acquisition of North Memorial Health by Sanford Health. We do need assurances as a community about what is the long-term plan to protect and preserve good health care in North Minneapolis and beyond. You know, I'm here not simply as a faith leader, but as one who has utilized this institution behind me for my own knee surgery. My wife has used it for when she had asthma attacks. My mother when she had a very serious car accident. And my father in the last days of his life, he was cared for by the staff, the nurses, the doctors at this very institution. We trusted them with our father's care, and we're trusting them for the community care. That's why it's very important that we understand healthcare is not merely a business transaction. It is a community trust. So we are calling upon for a community benefits agreement to assure the long-term care is still present here in this community. We shouldn't have to go outside of our community to receive quality care. With the federal cuts and all the things that are happening in our country today, we have to preserve those things that are essential, and healthcare is essential. When we're thinking about what's happening in our community right now, we need to preserve. And Minnesota, we have to do better. We have to do better. We believe that a community benefits agreement will wane some of the anxieties for not only the workers that are here, but also just the community was wondering what's going to happen when I need care, when my child needs to be born, when a traumatic experience happens to me. Where do we go? What do we do? You know, and we believe that our tradition that the leadership is a trust. That's why we're calling upon the CEOs of North Memorial Health and Sanford Health to step up to the table and do the right thing. Do the right thing. It's not hard to do the right thing. And especially when we know what the right thing is. And that is to make sure healthcare is accessible for the many and not just the few. You know, as I conclude, I would just say to you this. It's time for us to step up and protect this institution. We have to do it. No one else can do this. The voices of community have to do this, but we also have to have a listening ear and a partner with those who are in leadership here. Community benefits agreement is the way to go. I'm calling upon this, as is my colleagues and friends and supporters. Let's get this done. Let's do this today.
So as we close this morning, I just want to continue to lift up SaveMNHealthcare.com. We want as many people in the community to visit that website. We have a petition. We are asking for community members to sign that petition, to share their stories. And we're going to keep calling on the CEOs of Sanford and North Memorial to come to the table ready to negotiate a community benefits agreement. One that's going to prioritize patients over profit. One that's going to prioritize community over corporate consolidation. And so we thank you for your time. Thank you, thank you, thank you. Have a great day.